So we shall see about hernias this time. So what is hernia? Basically our abdomen wall, unlike the chest which has got bones, abdomen wall doesn't have any bone. Instead it has got multiple layers of muscle. On outer side there is a skin, on inner side also there is a skin like component called as peritoneum. So hernia means defect in the muscle with intact skin and peritoneum inside. So what happens whenever there is increase in the abdomen pressure, some intestine within the abdomen projects through the defect in the muscle. Okay, so the skin and the inside skin, otherwise peritoneum, are intact, but there is a defect in the muscle. Now through this defect, when intestine comes out, it is called as hernia. What can happen in hernia? It can be uncomplicated, like it can come out and go in whenever there is increase in the abdomen pressure, like whenever we are coughing. During that time, some intestine can come out and go inside. But when it really becomes complicated, like due to sudden increase in pressure, lots of intestine came out through the defect, it can form a bottleneck. So that whatever has come out will not go in. So what will happen at that time? There can be an obstruction of intestine. So bowel movement will be altered. The contents of the bowel will not be able to negotiate this. This is one complication. Second complication is the blood supply to the intestine. If that is also compromised, the bowel which has herniated or come out can undergo necrosis or die. So that is an extremely emergency condition. Otherwise, the contents within the bowel can cross the blood and can infect. This can lead to something called as septicemia, and at times it is life threatening also. So this is what happens in hernia. Now hernias can be happening per se or following a surgery. Like inguinal hernias or groin region, there can be few hernias where there are congenital defects which can become bigger in particular patients, and through that intestinal contents can herniate out. But commonly happens following surgery because of so many reasons. In defective wound healing, that can happen artificially, like following surgery. So does that mean a surgeon has not closed the wound properly? No. See, the healing is the problem here. Whenever the surgeon has not closed it properly, then the intestinal contents will come out in the immediate postoperative period. But what happens in hernia? This happens after months or years following surgery. So those are called as incisional hernias, and groin hernias are the one which are congenital hernias. So today we saw about what is hernia and what are the types of hernias.